let's get started. I really want to get through this because I'd really like to hear from everybody and have about 10-15 minutes towards the end for us to talk. Today is really going to focus heavily on production review and goal planning. So as we move past AEP, here we are, February, one whole month of Q1 is already over, and we really need to be thinking about our strategic planning. Everything to do with Medicare, with this side of insurance, it's a constant learning environment. You're always going to be learning something, so be a sponge. But today, I want you guys to really put on your entrepreneur hats. You are business owners. And for some of you, it takes a little bit of time to make that realization, like, holy moly, I'm an entrepreneur. I own my own business. You don't work for NCC. We're just here to help you and meet you where you're at and help you reach goals. So today, we want to really kind of dive into helping you understand your performance. How do I identify opportunities for myself? How do I create some clear and actionable sales plans coming into 2026? Because you're all in different places, right? And I don't want to digress too much, but many of you have full-time jobs and you've seen this opportunity to make some extra money with Medicare. Maybe your desire is to quit that full-time job and do Medicare full-time. Well, what does that look like? How many clients do I need? What's my replacement income? How many clients do I need to earn that income in order to quit my day job? Some of you are in a situation where, you are doing this full time. So it's paramount that we get up and running. So we want to talk about clarity around all of this, growth, and helping you build a business that's predictable and not totally reactive. Share one word in the chat that describes how you felt about your 2025 results from AEP or from last year in general. Alan, he said good. We talk to agents every day, and a lot of them will say, well, I wish I would have been able to write more. I struggled finding clients after the first couple of weeks. So today we're going to talk about all of these things. When it comes to the purpose of what we want to cover today, I mentioned this a few seconds ago, really taking a look at your performance data. So if a lot of you are on here that are new and you don't have performance data to look at, just listen to what we're talking about here and how you're going to have to be able to look back at what you did the prior year. How many clients did I lose? How many clients did I add to my book of business? How much cross-selling did I do? How many folks did I turn into a household sale? I got the husband, the wife, the kids, the relatives. We want to talk about identifying trends, strengths that might be in your market, and maybe some gaps that are in production, things that you might be missing. We have a worksheet for you. We are going to want to take a look at building some type of something that's personalized to you, but it's realistic. And that's why it's so important that you work with your sales development manager. You're all different humans. You all have different priorities, different obligations in your life. So it's really important that it's personalized to you and your situation, but it's also very realistic for you. And our last thing is going to be defining what are my growth opportunities? What are my target markets? How am I going to do that? What does all this mean? These are some fancy words. One of the biggest things is understanding data. We are in the thick of this right now. A lot of our insurance agents start selling Medicare and have zero clue how they get paid, what they get paid, when they get paid. They have no idea that that it's a 1099 pay. Sometimes they just don't think about it, and you've got to pay taxes on it. They don't know how to look at their commission statements, the status of their pending enrollments. So it's very, very important that you take the time to start out on the right foot and create good habits with this, because it's only going to save you time, money, and headaches in the future. Big headaches. We've got agents that just came out of their very first AEP, and we'll get emails or texts or calls that just simply say, hey, I wrote about 14 policies and I think I only got paid on 6. There is absolutely no reason why February 1st, you should be finding that possibly half of your enrollments didn't get processed. All of this information is available to you at any given time. One of the things that we try to do as sales development is to work with you in understanding that this can be overwhelming. All this contracting paperwork you're doing, all these different carriers and the emails they're sending you. You've got to have an organized way to keep track of these things. Use a simple spreadsheet. Here's all my carriers that I'm appointed with. You can log into your NCC self-service portal and see all of your contracts at any time. We can ask us, we'll show you how to get there. What's the website for their broker portal, their broker website? What's my password? What's my username? What is this website for? Every single one of these carriers gives you the ability to see your commission statements and download them, review your book of business. Almost all of them will let you see your pending applications and what the status is of them, and if there's any issues. It could be that this person lost their Part B and you didn't know that. They showed you a red, white, and blue card that had Part A and B on it, and they lost Part B. So now my enrollment application's pending. So it could be any number of things, but awareness, starting off on the right foot, making sure that you understand how to monitor your book of business and the things that you're submitting and doing. Again, at minimum, use an Excel spreadsheet. What I highly recommend is starting off with a CRM. Talk to us. There's cheap ones out there. I know we talked about this on our last training, but I want to reiterate how important it is to not be the person who just shoves everything in a filing cabinet or trusts Enrollment Central to be your CRM. Enrollment Central is just a platform for you to do electronic enrollments to save yourself time and money with paper. You need an actual customer relationship management system. They're super cheap. We've got lists of ones that we can send you guys, but start out on the right foot. And again, it costs money. You're an entrepreneur, right? You're the only person funding your business. Know how to find, read, and understand all of your carrier commission statements and book of business reports. Download some, get with us, talk to us. We'll go through those commission reports with you. It does get confusing because all the carriers do them differently, and the carriers pay at different points of the month or the week. So it just really helps. But this is your livelihood, right? Or this is your chance at getting out of that day job that you don't like and making this full time. So this is your money. This is how you're paying your bills and how you're living. This is going to be a little bit of a report walkthrough and explaining the difference between submitted business and accreted business. Accreted is another fancy industry term for enrollments that are accepted by CMS, approved, and your client's enrolled, and you're going to get paid because they are enrolled. The first thing is understanding when you look at your book. A lot of agents in their minds will say, oh, well, I know I submitted 150 enrollments. Well, submitting enrollments, i.e. booked production, is completely different than paid to agent production. You can submit enrollments all day long and have that number in your mind. But if it didn't get approved by CMS or it got kicked out, if it didn't get approved by CMS and you are the agent of record, meaning you are the signer, you're the agent who enrolled this person, and the carrier is giving you credit for that, then you're not getting paid on it. That's one of the biggest reasons why we harp so much on having a CRM. So all of your clients are in one place for you to find them, and knowing how to log into and find your commission statements and look at your book of business on the carrier portals. And we'd be happy to screen share with you and help you navigate. There's a lot of stuff on those carrier portals. They all have a different name. United Healthcare's nickname is Jarvis. Aetna's nickname is Producer World. So they call them something different. But again, you could easily save them as favorites, create yourself a little spreadsheet that keeps track of all of those logins that you do need. So again, the difference between submitted or booked production versus actual paid to agent production, there's the money, right? One of the things that you're going to need to pay attention to are cancellations and rapid disenrollments. There are any number of reasons why an enrollment might not be accepted by CMS. Some of them you can fight for, and some of them you can't. If it's an instance where Miss Betty, like I said earlier, showed you that red, white, and blue card, and you verified because you trained and you know they have to have Part A and Part B to get a Medicare Advantage plan, and you're like, what do you mean? The carrier portal's telling me that it was denied because she doesn't have Part B. She must not have paid her Part B premium. So we got to go back to Miss Betty and say, Miss Betty, what happened? Cancellations. You could find someone who really loved you and loved you so much that they enrolled with you and they had buyer's remorse. And they felt bad about leaving their other agent or whatever the situation may be. They can pick up the phone before that enrollment is in effect and cancel it. So we got to monitor these things. Rapid disenrollments, again, that's a term that's used for the first 3 months that your client is enrolled in a plan, no matter what timeline that is throughout the year. It's the first 3 months they're enrolled in a plan. Carriers pay on Medicare Advantage very quickly. As soon as that enrollment is in effect, usually you're paid within the first week or two, and they pay you out 12 months. If your client disenrolls in that first 3 months of their policy, their carrier is going to charge you back the full amount. So you also have to be prepared to have some type of cushion buffer in your account to account for things that sometimes just fall off the books. So you get paid that $700 on that policy from Miss Betty, and Miss Betty canceled, but you already done spent the money. You got to be careful, right? And then there's also carrier errors, which, you can fight those. And as you're learning about all of this stuff, as you are proactively going and checking your book of business and looking at it, if anything is confusing to you, call us. That is what we're here for. We're here to help you understand all these things. So one of the things that I want you to think about is the fact that as your book of business grows, you are going to be able to have so much great data that's going to influence how you're doing business moving forward. Titus, I want you to tell everybody what a good closing ratio should be, and what would an agent's attrition, what should their attrition rate be, and how much do they need to shoot for to replace that business and grow?
Let me go to the first one, closing ratio. Because I typically ask a lot of questions on the front end to just validate that this is a lead that I am pretty confident it's about 80% closing. So by the time I get to that person's house, if I'm in your house, it's about 85% of the time I'm going to close. But that's because at the initial time of meeting the person at the event or doing the Medicare one-on-one, I had a set of questions that I would ask. So I just kind of removed those individuals.
Mhm.
So I don't know if that makes sense to everyone. I just knew what to ask, and we can go into depth at the end if anyone wants to know what
Yeah.
the questions were. Now retention rate, you want to retain about 85%, 90% of these individuals. Some are going to drop off due to natural attrition because they move in the states you're not licensed in. You may not be contracted with a carrier, and unfortunately, people expire. So those things happen. But you typically want to shoot for at least minimally 10 to 15% growth every single year to
Mhm.
replenish those for those particular reasons. The carriers that you're not contracted with move out of your state, and unfortunately, people will
Mhm.
pass away. Or maybe there's a hospital network or a doctor that has a little bit more of an influence over them than you, and they're going to
Mhm.
definitely listen to that provider, and there's kind of nothing you can do about it. So,
Okay. So really what we want is we want an overall, I would say 80 to 90% closing ratio. So you want to vet your leads very well before you get to the house. That doesn't mean you sell first, right? We don't want to, sometimes you can kill a sale by overselling up front. Um, you want to be able to get to that kitchen table. You want to get to that living room with these folks. You want to meet with them. So we want to dangle a carrot enough to get to that point. But yeah, that's the closing ratio you should be shooting for. If you have a CRM, you're able to track that. You're able to actually see how many of the leads, the people that I've entered into this system, how many have I converted to a sale? And how many do I have still sitting out here that I haven't sold to, or I closed it because it was a no go? The attrition rate that Titus just mentioned, about 13%. We're going to have an easier way to help you conceptualize this growth path because we're going to actually put the income into humans and households. How many people do I need to enroll to make X? As simple as it is. And that number is going to be different for everybody. And of course, I want to go back to being realistic with this. So if you set this goal of I want to enroll 100 people this year, you better get busy and you better talk to your sales manager here and you better start doing what Titus said, which is getting out in the community to find people.
Hey there. Hey everyone. So when I was an agent out selling in the field, I was pretty successful. And one of my managers said to me, the goal is 15 to 18 appointments a week.
Mm-hmm.
So when you break that down in 15 to 18 appointments, that's really 12 apps a week. That should be easily done basically in 2 or 3 households. Because if you're offering Medicare Advantage, you should also be cross-selling other products like final expense or hospital indemnities. So you should
Mm-hmm.
be walking out typically with 3 to 6 applications per household. And that
Yeah,
would
and
give you,
ACA. Sometimes
right.
you're there and the spouse is retired, but one of them's still working and they're under 65. That's
Mhm.
a Medicare lead right there because you'll stick them on ACA now and a year or two later convert them over to a Medicare Advantage. That's a great point, Julie.
And if they're selling med subs, then they're going to walk out with a dental vision, a prescription drug plan, and perhaps a cancer short-term home health care, some other product that will help based on the needs analysis that you've done. But the goal really is 15 to 18 appointments. Try to sell between 50% to 80% of that, and then expect an additional 20% for drop off. And what are you going to do to make that happen? And that's what we all help you try to do.
Yeah, yeah. Just conceptualize it for yourself. What makes sense for you? I love that. Thank you guys so much. So this is just a quick review of exactly what we've all three of us have just said. What metrics, numbers do you need to make sure you're reviewing? Your total enrollments, your persistency rate. You need to make sure you're doing these things. So that we can get to a place where we have full awareness of what's going on so we can make the money. It's amazing what kind of snowball can happen once you start getting out there and creating a reputation for yourself, meeting business owners, meeting providers, getting out in your community. Sitting at home is not going to make you any money. Purchased leads are extraordinarily expensive. It's very hard to compete with like a telesales company. They've got gobs and gobs and gobs of money to buy these leads. A good lead, and somebody on the team, correct me if I'm wrong, but usually a fully vetted great lead is anywhere from $50 to $100 a piece. That's expensive. That is expensive. I would rather go out and have fun, go to happy hour with the Chamber of Commerce and meet people in my community, get dressed up and go door to door, store to store, and hand out my business cards and talk to people, go to events and meet folks in my community. I would much rather be doing that and taking actionable steps. Again, Medicare, this industry is more about service and servitude to your community. And once you get into that mindset, the business just kind of organically comes. The opportunities come. We have agents that get out there and do this consistently. And next thing you know, you're being asked to be featured on a podcast or a radio show or a webinar for, the hospitals having something, and they want you to talk about Medicare and this person to talk about durable medical equipment. You never know. These things will start falling in your lap, and it's pretty cool. It's pretty cool. So if you currently are on here and you do track your business, you use a CRM, or even if you just use a simple spreadsheet, which is cool, or you just use Sunfire, let's see where we are at. Click what it is that you actually use. And now I really want to get into identifying trends and red flags. Being able to track this data is, again, it's going to tell you what those closing ratios are. Is my persistency rate lower than expected? Am I not closing 80%? Self-awareness, record yourself doing a sales presentation. It might sound silly, but it's really not silly. You might be doing something or saying something that maybe people are not responding to. Practice with someone. Ask them for their radical candor, their feedback. You don't want to be bleeding out the back end and losing money, because this is a residual income game. We want to consistently be chipping away at our residual income. We want it to build and build and build. And we're going to look at that here in a second. Am I not cross-selling? Like, what's my cross-selling ratio? If you get that in to most of your presentations, you can slyly slip it in, a couple of sentences. Let me show you how we can fix that in a minute once we get through this. Am I missing out on all that money because I'm not bothering to mention ancillary? Am I not doing a great job matching people to the plans that they really need? Am I not doing my needs analysis correctly? Am I skipping through things? Are there opportunities that I'm passing by in my local community to have people sending me leads? So really being aware of all of this is very important. And again, having that CRM is going to be important so that you can, track all of this stuff. So we've taken a look back at 2025, all right? And now we're going to actually get into the realization of things, the goal setting. I want to write more business. I want to reverse engineer this whole entire thing here. So let's talk about this reverse engineering. If your income goal in 2026 is $75,000, how many Medicare enrollments does that require? Well, we're going to get to that. We're going to show you here in a minute, and it's going to be more income than 75,000. But some concepts we're going to talk about here are going to be starting with what my revenue goal is. Then, like we just said, determine how many enrollments are needed to hit that. The next thing you need to do is, well, gosh, if I need to enroll X amount of people, how many leads do I need to get in front of so I can close that many sales? So, and then determine the activity, the effort on your part that it's going to take to generate those leads. So we're reversing it, right? We're starting out with, hey, I want to make 100 grand. How many people is that? Do I need to enroll successfully? And how many leads is that? And what do I need to get those leads? So let's talk about the process of that. And this is just to get your wheels turning. We've got worksheets for all this kind of stuff. So the first thing you need to do is you need to set your income target. And earlier I said, you're all in different situations. You have different priorities. Some of you want this just to be a nice side gig that you do on the side part-time, and you just want to make a goal of earning an extra 20,000, 25,000. If that's your jam, cool. Let us help you figure that out, how to get there. If you're wanting to actually replace your current income, so this can be your full-time gig, let us help you figure that out. If you are full-time in this is your only source of income. We got to get rocking and rolling. Let's go. So we want to help you figure that out. Set your income target, and then you're going to convert that income. You're going to say, what am I licensed to sell? I can sell Med Advantage. I can sell Medicare supplements. I can sell ancillary products. I can sell life insurance. I can sell ACA. Now, what's your target going to be? We're targeting Medicare Advantage, right? And we can cross-sell life insurance and ancillary. My Medicare Advantage client might turn into a Med Supp client. What demographic do you want to go after? Do I want to go after low-income households? And that would be a person who's on Medicare and Medicaid, a D-SNP. So you have to start breaking these things down. Agents that are focused in this way and go out into the field with a purpose are usually the most successful. I have an agency in North Georgia. It's a father and two sons, and about a little under 10 years ago, they decided that they were going to divide and conquer, and they were going to target D-SNPs. So they targeted food pantries all across North Georgia. They built relationships with all of them. They set up tables at the food pantries. They volunteered at the food pantries, and they built themselves a very large business. They had a focus. They went out into the field with a purpose. They stayed consistent with it. So you've got to figure out what your focus and purpose is going to be. And then after you figure that out, we're going to help you figure out quarter by quarter how you reach these goals. Because right now, quarter one, if you are an agent with some clients, it's retention season. We talked about this already. Quarter two goes into all of that checkups and cross-selling and pipeline building, setting yourself up. Quarters 2 and 3, that's go time. That is, I am out every single day doing something to help build my business. Success isn't just, I sat with a beneficiary and I enrolled them. Success is consistently waking up with a purpose and getting out in that field and making a plan for the week. Who am I going to target? Where am I going to stop in at? NCC can help equip you to be out in the field as a real business professional. We're very passionate about what we do, and helping you so you can help beneficiaries is our passion. We have a all-around goal of touching 1 million lives at NCC. And that's what we want to do, is we want to touch 1 million lives in a positive way. And who does that? You guys. So this is what we want you to do. We want you to do the math. And I am so excited because we hope to launch a commissions calculator that will help you guys with this. But these are just two spreadsheets or two charts. The one on the left is going to just help you conceptualize household income. So let's take a look. We've gone to a house and we've sold Mr. Jones a Medicare Advantage. Average commission $700. That's pretty darn good. He's new to Medicare. And he needs a hospital indemnity. I cross-sold that. I just made another $135. And then what do you know? He's got a spouse that he retired. He lost his group insurance and she needs ACA for at least the next year or two. That's another $240 in income. So just in that one single household, because I did my job, I've earned $1,075. Now, next year, that household is a residual income household. It is a renewal to me. I've serviced them, I've kept them happy, and they're staying on the books with me. So now next year, I'm going to make $350 in residuals off of the Medicare Advantage plan. I'm going to make $54 off that hospital indemnity, and I'm going to get another $240 for that ACA plan. So that's just a single household concept. Now, if we go to the chart on the right, you're going to see I've got this broken down into sales goals year 1, year 2, year 3. So year 1, I don't have any residual income yet, right? I'm trying to find people. So let's just start out kind of not, I don't want to say low, but real expectations. What can I do? I can make a goal of finding 50 people. I want to get into 50 houses. That new business revenue is probably going to get me about $54,000. That's not too shabby for a side gig. It's easy to find 50 clients, y'all. If you work with us and you get out, that's really great. So now I'm going to go into year 2. Year 2 is when I'm going to get some residual income. Those 50 people I worked hard for last year, they stayed on the books with me. I made another goal of adding another 50 to my book. Now I've got 100 clients. Holy cow. I've earned another $54,000. But guess what? I'm going to get my $54,000 off of my new 50 clients, but the other 50 from last year, I'm going to get $32,000 in residual income. Now my total income year 2 is almost $86,000. This is a residual income game. Service, keep these people happy, take care of them, and it will grow and grow and grow. So year 3, I am shooting for adding another 100 or another 50 clients to my book. And now I've got a total household of 200, or actually I raised the goal. 2 years in a row, I made my goal 50 clients. I can do this because the last 2 years, I've been out there making my lead resources. I have been nourishing my relationships with everybody that I can to get leads coming to me. So I'm going to make my goal. I'm going to up the ante and say, I want to do 100. I want to do 50 during AEP, and I want to enroll 50 clients during the lock-in period. So now I've got 200 clients. I've made another $54,000. My residuals, guys, look at that residual. The residuals doubled from the previous year. $65,000 almost in residuals, and my annual income's $118,000, $150,000. So total households, 200 clients, over 6 figures in income. Now you got to pay taxes on it. So y'all need to make sure that you're taking care of that stuff. So, and don't ask us, go to an accountant, go find somebody that can help you out with that, because we cannot give legal advice and we also cannot give financial advice. So now that you've seen that, and those are average numbers, you're going to need to do it with what your commissions are. Some states, some products pay differently. So again, knowing what you're going to get paid, talk to us. We can help you figure it out. What is your desired income goal for 2026? Stick it in the box and click submit. We really do want to see what you guys want to make. So 2026, a strategy map. This is getting into your target markets. And when we say target market, all these fancy marketing terms, when we're talking about Medicare beneficiaries, there's different types. There are people that are turning 65 every day, every month, every year until like there's 10,000 people plus turning 65. Oh gosh, until like 2032, 2033, something like that. The baby boomers. How do I get those folks? How do I find those people? How do I get in front of T65ers? There are folks that they're low income, LIS eligible, low income subsidy. You have populations of people that have chronic conditions. There are Medicare Advantage plans that are for people with chronic conditions. They can enroll at any time during the year. Do they have diabetes? Do they have congestive heart failure? So how do I find people that are diabetic? Do I have a diabetes workshop and I bring a dietitian in as my draw to come and learn how to eat healthier, give me a grocery list of suggestions for the grocery store? Do I bring that to as an option to the local senior center and try to partner with them on something? This is what we love to do, is talking to you guys about how do we find these target markets. Dual eligibles. Those are people that are so low on income that they actually qualify for Medicaid. So it's Medicare and Medicaid eligibles. They are dually eligible. There's an income threshold they have to meet, income, assets, and resources. How do I find those people? I mentioned food pantries earlier with those guys that got out there, volunteered, did tabletops, handed stuff out, created consistent rapport with the people that ran the food pantries so that they got referrals from the food pantries. And they were always there, facilitating coat drives, just doing things like that. So there's also the veteran population, getting connected to the VFW, getting connected to the American Legion. If you're a veteran yourself, that could be your shtick. There's tons of lead sources, guys, and we will get into this when we will really unpack all of this when we get into our grassroots marketing training. That's our passion. We want you out there having fun. We want to help equip you with the things you need to get out there and have fun. We have an event in a box to make sure that you feel professional when you're out there. Work with us on that. There's community events. Get onto your local community event calendar. Everybody's city that they live in, the county that they're from, has a website. They usually have event coordinators. What's happening? Are they having some kind of soiree? Is there a festival? Get a tabletop. There's community partnerships.
One of the things that helped me in my career was actually attaching myself to events, as Rachel just referenced about finding local events. Use Google, use Eventbrite. Facebook actually has events. If you just go to Facebook and hit events and then type in health fairs. The other part is create events. You can literally go to a community rec center where seniors are at, or go to a senior housing complex and create an event. Springtime is coming up. You can do something with planting seeds and flowers. Just get creative. Valentine's Day. If there's any agents, did you guys do anything for Valentine's Day? Those seniors want to engage and interact. You could simply get a DJ to come out, go to Family Dollar, decorate the space, put up a bunch of balloons, and put a couple flyers out. And I can guarantee they just want to come out and engage. And as they're dancing and talking, you're going to mention what you do and how you help and what different things that, why you're here, so if you will. So just creative, and don't just depend on them responding and calling you back. You will have to get up and drive over there and check in and just, hey, did you get my email? Can I get on your calendar?
The sky's the limit. And this is where we get super excited. And I am going to have to really rein myself in, because our team can talk about this all day long. I love getting creative with events because I want you to have fun while you're going out here servicing your community, making other people happy, but you're also earning money while you do it. It's awesome. I like to tell agents that when you're thinking about what you could do, when, like Titus mentioned, getting creative and creating your own event, make it unique, make it you're unique. Is there something that you love to do? Do you love to play an instrument? Are you talented in that way? I am not. I also cannot sing, even though I do it when nobody's watching. Put on a musical thing, like go to the senior center and say, hey, do you guys have a piano? Or do you own a digital keyboard? You could go do music night for a couple hours every other Wednesday at the senior center, and it draws people in. You have a little table next to you that promotes your Medicare stuff. And you're not pushing anything. You're just saying, hey to everybody, this is who I am. This is what I can help with. Now let's listen to some music. I'm going to play some, you know, ragtime for you guys, whatever it is. But you can get creative. We have agents that love to golf. We have agents that love to garden, anything. Agents that love to exercise, partner with Silver Sneakers. The carrier reps are going to be some of your best friends too. They're the ones that have all the goodies. They have the stress balls, the Band-Aids that are all branded. When they know that you have booked events, their job is to give you stuff so that their branding gets out there. They also can give you some co-op money to help pay for things. I had an agent who got connected to her local senior center, and they had a giant room with 6 pool tables in it. And she just, from coming in, she noticed that lots of people love to go in there and play pool. So she just asked the activities coordinator, hey, have you guys ever thought of like having a pool tournament? And they said, no, but that would be awesome. And it snowballed. That activities director called the adjacent 2 counties, their senior centers, and they bust in. So this is 3 senior centers worth of people coming to her pool tournament. She connected with Humana. Humana gave her goodies and giveaways. They also gave her a few $100s, and that paid for the pizza and the soda and the sweet tea that we had. She went to Sam's Club, got a tray of cookies. And I went, actually, this was her first event she ever did. So NCC helped create her flyer for her that they posted up and emailed out. It was amazing. The senior center just said, hey, let's all give a round of applause and thank Miss, Kathy for coming out and helping host this today. Kathy, would you like to say a few words? She introduced herself, had her Medicare table. It was awesome. When you make a plan and you're forecasting, right? Another big corporate term, we're forecasting. We just need to make a plan. What are we going to do? We need to wake up with a purpose. Weekly appointment targets. How many appointments do I need? Monthly lead targets. How many events do I need to do to generate the amount of leads I need to close the amount of appointments, or to make the amount of appointments I need, and how many of those do I need to close to earn the income that I've set, right? That reverse engineering. You want to set quarterly goals. You want to have an event schedule. You want these things scheduled out, research, look for these opportunities. You want to have goals for partnerships. You want to look in your community and realize that there are holes or gaps that you can fill. Did a local dentist, do they not take a major insurance company in town? But you have a product that they accept. Let's say they dropped Humana, but they take United Healthcare and they love United Healthcare. Well, a dentist office, a doctor's office, their priority, and I don't want to digress too much, but their priority is they're building their patient panel or retaining their patient panel. They want to either build and they don't want to lose, right? That's their money. So working with us to talk about how do I get into provider partnerships will help you realize what's important to providers, how you position yourself, all of that stuff. But you're wanting to create constant opportunity for yourself. And then, of course, certification timelines. Certification season, it's the dreaded AHIP season, all the carrier certifications, but you've got a serious job. The services you provide, putting people on insurance plans, that's real life stuff, right? I mean, that's serious stuff. You're talking about impacting people's health in their pocketbook. So it's very serious. And we need to take our certifications very seriously. So the moment those suckers come out, nose to the grindstone, knock them out, get them done. Because guess what? If you do not certify, that's out of compliance per your contract with the insurance carrier. And if you have any residual income, you will lose it if they terminate your contract. So certifications can't be serious enough about that. So there's a little quote here. Success is not about trying harder. It's about consistent activity tied to your goals. So activity breeds success. Locating the highest growth opportunities. All kinds of fancy words here. 2026 Medicare market dynamics, carriers expanding or contracting in a region, plan benefit trends, LIS and DSTIP growth projections, all kinds of fancy marketing terminology. But basically what you're wanting to do is every year, Medicare Advantage carriers have to plan with actuaries what their plans are going to look like, how much the copays are going to be. It's very complicated. They have to submit those plans, those plan ID numbers to the Centers for Medicare and Medicaid, so CMS. They have to submit that, and it has to be approved by CMS. And sometimes carriers will cancel a plan. They're not going to offer it any longer. Do you have any clients on that plan and it's going to terminate? Well, guess what? If you have clients on that plan that is terminating, other agents have clients on that plan, it's terminating. Other people are enrolled in that plan. Those are opportunities. Is a carrier brand new coming into the county that you service? Devoted Health, it's a great example. It's one of the fastest, steady growing Medicare Advantage carriers in the country right now. And they are consistently, strategically expanding. So that might be a new opportunity for you to realize, oh, I need to get contracted with it because this might be a good opportunity for my clients. Plan benefit trends. What does that mean? That might mean that for years, this Aetna plan that's been super popular in my area, and I've got lots of clients on it, it might be that they dropped their dental benefit. And that was what made it one of the better plans. Oh my gosh, that's a plan benefit trend. People are either losing benefits, the benefits are changing, or benefits are being added to, like, oh, holy cow, CMS just approved Medicare Advantage companies to offer over-the-counter benefit cards. So there's lots of things to be aware of. Now, one of the things that NCC does, and what we try to do as sales managers, is we work on territory. All right, so agent growth segments. We've talked a lot about this. Finding people that are on extra help or eligible for extra help. I hope you guys got a pen out, because did you know if someone has never applied for extra help, they've never applied, they've got zero status. If you help this person apply quickly online for extra help by asking a few simple questions that are not invasive or intrusive, they might qualify to have all of those wonderful things happen for them to save money on their prescriptions. I mentioned this earlier. They don't have to pay a deductible. They don't have to pay a penalty if they have one. Their prescriptions are put on a set copay, no matter what company they're with or how much that carrier wants to charge for that drug. It's wonderful. You can help folks have to pick between food and drugs, right? If you can help them get qualified for extra help. Dual eligibles. You would not believe how many folks out there they just don't know. To us, it seems crazy that they wouldn't know, but you would be surprised at how many people don't know that they might qualify for Medicaid. And if they qualify for Medicaid, they qualify for so many extra benefits. They qualify automatically for extra help. So their drugs are already zero, if not very low copay. Most of their copays are $0 copays, which is fantastic. So there's lots of amazing things that can happen there. These are the types of growth segments that we predominantly see agents going after to find clients, right? because let's just be honest, you're not going to have a ginormous book that's nothing but people who just turned 65. So you get the max commission amount, right? It's not a reasonable thing to think. Very important that you learn and diversify and understand these things. We can help you. There's easy charts that explain income, assets, and resources so that you can ask some questions to see if this client might be eligible and they might qualify. Veterans, that's a huge population. If you live in a state that is very VA forward, there's a military base, XYZ, understanding how TRICARE VA benefits and CHAMP VA differ from one another and what they actually are to a veteran is very important. So that's also a very unique segment that a lot of agents go after. It can be tough, right? If you're an agent that is a veteran, that would be a really good target market for you. And of course, we talked about our folks that have chronic population, people that have diabetes. So definitely some amazing opportunities there. And I want you very much so to connect to your sales manager here so that we can look into your area and help you identify, do you have pockets of these people around you? So we're going to talk about SMART goals. What exactly is a SMART goal? That's another one of those fancy marketing terms, right? So let's get into what exactly this means. So SMART goals. So SMART stands for specific, measurable, achievable, and relevant time-bound goals. So all the things that we talked about earlier, we want it to be realistic. We want it to be something that you can actually measure. So when we talk about a numeric goal, that is going to be your enrollments and revenue. How many enrollments do I need and how much do I need to make? You're going to have a channel goal. Which marketing lanes am I committed to? You need to have a skill goal. What am I going to learn? What do I need to improve upon? You're going to have a retention goal. You need to have a good persistency rate. All right. And then, of course, a pipeline goal, which is how many leads do I need to generate each month? Let us help you figure out how you're going to get there. But I'm going to be real with you. We're just talking heads. We're just talking. We can talk and say, but we can't go and do for you. These are things that you need to go out and do for yourself. Again, waking up every day with a purpose. I work from home and I commute to Knoxville, probably a handful of times throughout the year. I'm passionate and committed to my job. So when I sit down, I'm sitting down and I'm working. Same with you. I know the struggle of looking around and saying, oh, the dishwasher needs emptied, or, oh, I make my own schedule so I can, go to this or do that, or, oh, to heck with today. I really don't feel like going and getting dressed up and doing this and doing that. Got to push through that stuff. You have to stay self-motivated. And if that self-motivation, if you're having a tough day and you're like, I just don't know what I'm going to do this week. Call Julie, call Danielle, call Titus, call Angie, call me, call Alec, call us. We can help you scrounge up an activity agenda for the week. If you're currently working a full-time job and you're sitting here going, holy cow, you're telling me I need to do all this. Like, when am I going to have time to do this? I've got kids. I got to go home. I got animals. I mean, I'm in the same boat, y'all. I've got 2 kids, 4 animals, parents we take care of. I'm there. Make yourself a goal, 30 minutes every day after work. It's going to take me an extra 20 to 30 minutes to get home if that's feasible. And I'm just going to drop into some local businesses with a stack of my business cards and a flyer or just a message. Just going to create some rapport. It's about figuring out if you really do want to take advantage of this opportunity that's been given, all this hard work. Listen, you guys are licensed. You went through all that. You are keeping up with your CEs. You've paid money for all these things. Let's go. Let's go. We are here. We're committed. So two-way street of commitment. We're here to support you. We're here to help you keep motivated. We're here to work through these concepts and ideas. And, we just really want you to be successful. Again, there's no right or wrong or perfect way to build your business, but we want to help you get there. And these are baseline things that you should try your hardest to implement. I guarantee you that if you set a goal and you do what's needed to realize that goal, you're going to get there. You're going to meet it. So we've thought about SMART goals, and we've thought about our expectations, right? So expectation setting is going to be the biggest factor in preventing you from getting overwhelmed. Be realistic and give yourself accountability, and think about what do you want that accountability to look like? Do you want accountability to be your sales development person here at NCC? Do you want it to be a spouse? Do you want it to be a friend? But create some type of accountability for yourself. We really want you to work on this spreadsheet that we're going to give you. It's not a spreadsheet, I'm sorry, a worksheet where it's very simple, but all the things we talked about, one specific revenue goal, one new habit or skill that you want to adopt, one marketing channel that you would like to focus on to get your feet wet. Know and understand your numbers. Connect with us if you need help, but dive in, start looking at everything. Build some type of realistic, repeatable plan for yourself. I just mentioned if you're working full time, can you spare 30 minutes on your way home from work? That's an everyday repeatable thing. Maybe I only do it Tuesday, Thursday. Maybe I do it Monday, Wednesday, Friday, but build some type of realistic, repeatable plan. And grow by choosing to focus on the right segments, figuring out what the right segment is for you. That can be totally different. We're talking about Medicare in a very broad way. And we like to tell folks, don't put all your eggs in one basket. But we do have agents who, maybe they come from a financial background. We have agents that are tax attorneys. We have agents that are tax preparers. We have that are they're financial retirement professionals. And these people get contracted with Medicare because they see the need. They're like, you know what? I'm helping these people save all this money into retirement, and I'm constantly referring them out to other folks because I don't do Medicare. It would take me 20 minutes to help them get on a Medicare Advantage or a Med Sup. So, it might not ever be your full-time gig. It might be your only source of income. So again, everybody's different. But setting SMART goals for yourself is what's really going to set you up for success. Thank you guys for staying on here. Thank you for partnering with us, and we will talk to you in 2 weeks.